Good morning, class. How are we doing today?
Good morning, Miss Frizzle.
Are we ready to get started with today's lesson?
What? Miss Frizzle, no. Arnold's not here.
Oh, good observation, Ralphie. Arnold's mom actually called me yesterday. She said that Arnold is actually in the hospital with meningitis.
But, Miss Frizzle, what is meningitis?
Good question, Carlos. Meningitis is the inflammation of the meninges.
No.
Yeah, it's due to some bacteria. So I was thinking, why don't we go visit Arnold in the hospital and learn more about it?
Yay! Woo!
All right, let's go.
Great. Miss Frizzle, what's that?
Oh, I know. My grandma had one of those when she was in the hospital. It means you have to wear special kinds of equipment before you can go in the room.
That's right, Carlos. Does anyone know what kind of equipment we might need to wear?
The poster's blue, and blue makes me think of water. Miss Frizzle, does that mean Arnold's disease is transferred in like water?
Basically, you're right. Ralphie, Arnold's disease is transferred through his sputum. The bacteria in his body comes out through his sputum, and that means that we can breathe it in. So what do you guys think we need to wear?
Maybe something over our faces that's covering our mouths so we're not breathing it in.
That's
And my
right.
eyes. I don't want any sputum in my eyes.
That's gross.
Yeah. Good job, children. We need to wear masks and eyewear. Let's get those on.
Hi, Arnold. The whole class is here to see you.
Don't turn on the lights. I have a splitting headache, and keep your voices down.
Oh, I'm
Sorry, Arnold. Is there anything we can help you with?
Yeah, come closer. My neck hurts so bad. I can't see you.
Can anyone tell me why Arnold's neck might be hurting?
Well, he said his head hurts. So maybe it's just that if he moves his neck and his head moves too much, it hurts even more.
That does make sense, but this is Miss Frizzle we're talking about here. The answer is never that simple.
Well, it isn't that complicated. I got infected by inhaling someone's dirty sputum. After that, the infection settled into my epithelial cells in my respiratory tract. And after that, the infection entered my bloodstream and was carried to my central nervous system. Since cerebral spinal fluid has few antibodies, an infection settled in, causing my brain tissue to become edematous and inflamed.
That's right, Arnold. Excellent account of the pathophysiological process of bacterial meningitis. Now, can anyone tell me, what are some risk factors that might have put Arnold at risk for this?
Miss Frizzle.
Go ahead, Carlos.
Well, I don't know if you've ever been to the bathroom with Arnold, but that boy don't wash his hands. Also, he picks his nose so much. And there's like 8 people living in his 2-bedroom house. He did have a cold recently, and I remember he was using like nasal sprays. So maybe he was like a little bit immunocompromised, and maybe that put him at like a bigger risk to get it.
That's right, Carlos. Good job. You really looked into this. Now, before we go any farther, why don't we go on a field trip?
Yay!
Let's go inside of Arnold, like we were the bacteria, into his respiratory tract, and then up to his meninges, where the bacteria are infecting him right now.
Okay, I'm so excited, Miss Frizzle.
Let's go.
Oh no, not only do I have meningitis, but now you're going on a field trip inside my nose too? I knew I should have stayed home today.
Okay, class, as you can see, we entered through Arnold's nose into his respiratory system, just like an infected drop of sputum would. Now, the sputum is infected with N. meningitis. That's a gram-negative aerobic bacteria that causes bacterial meningitis once it passes the blood-brain barrier.
Oh, I heard that one wasn't good at all.
Yeah. So we're taking the same path as we entered his nose, went into his lungs, and now we'll be traveling through the bloodstream all the way down to his central nervous system, where we'll pass the blood-brain barrier just like the bacteria did.
Look at that! Whoa, what is that?
Let's keep going. As you can see, it's getting a little bit crowded in here. Those bacteria are really spreading fast. Arnold doesn't have a lot of time left. We need to get out of here.
Let's go, go, go!
Quickly, Carlos, go find a nurse.
Okay, nurse, I need you. Whoa!
You called for a nurse?
Yes, we were just inside of Arnold, and it looks like the meningitis bacteria is really spreading rapidly. I think he needs some intervention.
So we have a number of medications and nursing interventions that could help Arnold get better.
Like what?
Well, let me check his chart. Well, if it's a gram-negative infection, we're going to give him aminoglycosides, carbapenems, or cephalosporins. And usually for 7 to 21 days, an IV if possible, because it gets into his CNS quicker that way.
But nurse, what about all his family he lives with? Could they have it too?
Well, the other 7 people that live with in his 2-bedroom house needs to go on prophylactic treatment in order to prevent the infection from spreading within them.
Well, since we already know for sure that Arnold has meningitis, how do we take care of him from here?
Well, there are many nursing interventions that we can do. First, we need to monitor the vital signs. We need to check for neurological signs. We need to check for intracranial pressure as well. We need to initiate seizure precautions. Notice how the sides of the bed's rails are up. We put the bed in at a 30-degree angle to prevent neck flexion and hip flexion. We administer analgesics because he's in pain, and we administer the antibiotics. We also put him on respiratory isolation for the first 24 hours, so technically you guys aren't supposed to be in here. And then monitor for signs of seizure activity. Great.
Excuse me, nurse,
Mhm.
but how did you know what he had? I mean, when he first came in, what made you suspect that it was meningitis, and what made you do that culture sensitivity test you talked about?
Excellent question.
Gold
Well,
star.
before we start treatment with anyone, we ask them a lot of questions. We get their medical history, conduct a physical exam, and get some key indicators. In Arnold's case, he became acutely ill, and he was sensitive to light and was very stiff and had a painful neck. Those symptoms guided us to take a blood sample and a sample of his cerebrospinal fluid for analysis and cultures. The result of those tests showed an influx in chemical mediators, inflammatory cells, exudate, and cerebrospinal fluid of the meningeal tissues. If for some reason the test came back inconclusive, there are some other tests that we can do to confirm or rule out meningitis as a cause of illness. One is called the Koenig sign. So Ralphie, why don't you lay down here so I can show the class what that looks like.
Okay.
Can anyone here tell me what the Keurig sign is?
Well, this is a sign to check for symptoms of meningitis. So, as the nurse demonstrates this, let me explain. Well, you can see here that Ralphie is laying straight on his back. That's called the supine position. The nurse will bend the legs up toward Ralphie's head. And if there's pain, that means that it's irritating the meninges by stretching them. So therefore, that would be a sign of meningitis.
No pain, no meningitis.
All right. Can anyone tell me what the Brodinsky sign is?
So in the Brodinsky sign, Ralphie is going to be laying down again. The nurse is going to flex Ralphie's head up toward her chest. Now, as you can see, nothing happens. But if Ralphie had meningitis, like Arnold here, his legs would flex up like so. Now, why does this happen, class?
I don't know, Miss Frizzle. Can you please tell me?
Well, Ralphie's body is trying to protect his meninges by flexing his feet as they're irritated and stretched. So by flexing the feet, it protects them.
Oh, that makes sense.
Yeah.
Spot on.
Thank you, nurse, for demonstrating.
Oh.
Wow, thanks for all that information, nurse. That was really informative for all the students.
Yeah, thanks, nurse.
No problem.
Arnold, we really hope you get better soon.
Yeah, thank you so much. I'll be back in class as soon as I get better.
We can't wait to see you again.
Can't wait to see you.
Bye, Arnold. Feel better soon.
Bye, Arnold.